Inflammation is an effective tool for fighting infection and healing injuries.
However, the sinister side of chronic inflammation is linked to a whole host of health problems.
On this episode, we talk about the pros and cons of inflammation and how chronic inflammation may be
killing your dreams.
But we're also in our 5-episode series talking about all the shit we put in our body that causes this inflammation.
Absolutely, bro.
And how it completely affects our focus.
Absolutely.
Let's dig in.
Bro.
Yes.
Inflammation.
What's your name?
I'm Jonathan Noel.
And I'm Brian Noel.
This is Forms of Focus.
Where we provide guided forms that manifest
radical
focus. Where we want you to be, it's been a while, as boy. Nice save, bro.
Absolutely. I'm here.
So what are we talking about today?
Inflammation.
You mean we're talking about inflammation on a focus podcast?
Well, it's kind of important, I guess.
I think in this episode you'll find out that it gets to the brain, but we'll get there.
Your brain has some things to do with focus sometimes.
That's right.
So,
let's start.
All right. Inflammation. I feel like it's been kind of a hot topic lately, maybe. Yeah. I don't know. I feel like I'm seeing it more.
Yeah.
But yeah, there's two forms. Acute inflammation, obviously, you cut yourself or you nick yourself. It gets kind of red around the edges, your body's reaction. And then there's long-term inflammation. So acute inflammation, immediate response. Obviously, long-term, not.
So here's what we know.
What do we know, bro?
It comes on quickly, usually within minutes. This is short-term and acute inflammation, right? But it can disappear within days, according to the Harvard Medical School Special Health Report, Fighting Inflammation. But it's so funny. Actually, when I read this, thinking about cutting your finger and seeing that, I'd never looked at that and go, oh, my finger cut's inflamed.
Yeah. Well, it's like when you get stung, like you get stung by something. Yeah. You get the bump or like your skin raises up.
Yeah. I didn't think of that as like an actual body function to fix something,
It's actually an important thing. The good parts of inflammation. So when you're injured, inflammation, it is necessary for the area. It becomes red, it swells as an army of beneficial white blood cells flow to fight any infections and help you heal. The same response occurs in other parts of your body when you encounter a virus or infection. So that's when it's doing the right thing.
But it turns out...
What's that, bro?
After years and years and years of ingesting terrible things and destroying our bodies, there's also the bad.
Ooh.
When you're injured, that's yours. The bad. Chronic inflammation is not short-lived and is rarely helpful. Although it may begin with the same cellular actions as acute inflammation, it morphs into a lingering state that persists for months or even years. The body sounds the alarm and emergency help arrives, but the threat never recedes, and the fire continues to burn.
Ooh.
That's intense, bro.
That's one way to look at inflammation. Your body is on fire.
So this is from the Harvard Medical School that we referenced earlier, but yeah, it's like chronic inflammation is literally setting your body on fire.
Right. It's a response, an immediate response to help cure or to help heal an area, make sure you don't get an infection, like if you have a cut, and it does its job. It's kind of like all hands on deck, but it's not supposed to last for years. Yeah, bro. So the fire's been burning. It's not good. So some examples of chronic inflammation. So this is when your body continues sending inflammatory cells even when there's no outside danger. All right. So something like rheumatoid arthritis. This is where inflammatory cells and substances attack joint tissues, leading to an inflammation that comes and goes and can cause severe damage to joints and pain.
Isn't that wild?
Wow. So your body's
attacking itself.
Yeah. It's not good.
Which is pretty strange. There's a lot different opinions on why.
Yeah, definitely.
But the most common reasons for chronic inflammation include autoimmune disorders such as lupus, where your body attacks healthy tissue. Like we said, this is the body literally attacking itself. So some of this comes from exposure to toxins like pollution or industrial chemicals, untreated acute inflammation such as from an infection or an injury. This is from the Cleveland Clinic. So if you have some type of injury, you don't treat it, and it just manifests and continues, that can cause this. But yeah, so a lot of this comes from toxins, which we'll talk about in the next 5 episodes. That's what we're talking about.
Yeah, so here's a little bit that we read. The science has shown about chronic inflammation. Low-grade inflammation can turn into a silent killer. Very nice. And contributes to a host of diseases.
Wow.
Okay. So those include Alzheimer's, allergies, asthma, hardening of the arteries, arthritis, eczema, autoimmune disorders. Ouch.
Yeah.
That's not the list you're looking for.
That's not good.
To have, going on in your life.
Gosh, inflammation. So, bro, we're here to talk about focus.
Yeah.
So here's where it affects the brain. Inflammation in the brain. When you stub your toe or cut a finger, the resulting inflammation is rapid and obvious. Deep inside your brain, inflammation can be more gradual and much harder to detect. Yet the effects of long-term inflammation on the brain can be much more destructive than a visible toe.
Makes sense.
Yeah.
So we're talking about a response that helps you deal with infections. It goes to the area, floods it with, whatever, your immune system cells. And so if you have inflammation in the brain, that just...
Didn't we talk about on one episode that your brain, have you ever, apart from migraines, you don't feel if your brain is sick or...
You don't feel if there's inflammation in your brain.
Yeah. So all the toxins in your body that cause inflammation, there's toxins in your brain. And it's inflamed.
Don't inflame your brain.
Inflame in the brain.
So, right. Talking about inflammation, we're talking about focus. Researchers have linked brain inflammation to the development of neurodegenerative conditions like Alzheimer's, Parkinson's, as well as mental health conditions ranging from depression to schizophrenia. This is from Fighting Inflammation.
Wow.
So definitely not... It's not something we're looking for.
Yeah, trying to focus, and you may have depression. You may be, we're going to talk about...
What are some signs, bro? I'm reading some signs.
Nice. Bro, what are some potential signs of chronic inflammation?
So, these are things that most of you probably have not experienced. No, just kidding. This is something everyone has dealt with. Fatigue, lack of energy, depression, anxiety, muscle aches, joint pain, constipation, changes in weight, appetite, headaches, fuzzy mental state.
So what's really interesting is when we were reading this stuff before, and you read about rheumatoid arthritis or lupus, you're like, well, that's not me.
Yeah.
But then we sit here and say, here's some symptoms of chronic inflammation. Are you tired? Do you have a lack of energy? Do you have muscle pain? Are you depressed sometimes? Do you have anxiety? There's so many of these things that may be from inflammation, and we typically are like, well, I don't have arthritis, so I'm fine.
This is almost like this list of signs or symptoms is almost like snake oil, where you list things that everyone has.
Yeah.
And then you try and sell them something.
Yeah.
It's like, are you tired? Here's why. Buy my pill. But it all adds up. It stacks up.
Yeah, it does.
It all stacks together. And I'm not saying that everyone has inflammation because they're tired.
Yeah.
But
you might.
But you might.
But you might. So things that cause increased chronic inflammation, inflammatory foods, fast foods, cured meats with nitrates, refined oils, trans fat, refined carbs and sugar, smoking, excess drinking, lack of sleep, chronic stress. Does this sound familiar?
I don't know, bro. Have you done any of these things recently?
So I put my beer down.
Are you chugging alcoholic beverages while you're eating cured meats and eating deep fried foods, and then finish it off with some carbs and dessert?
Yeah.
Sounds awesome. I want to do that.
So what can we do, bro?
What can we do? All right. Obviously, we're not doctors. That should be obvious by now. So things like drugs, non-steroidal, anti-inflammatory drugs. We're not even going to talk about that.
Yeah.
We're not. Go to your doctor if you have terrible arthritis or autoimmune diseases.
Yeah.
We're just talking about chronic inflammation from abusing your body, from doing day-to-day things that are bad for you.
Yeah. So some things you can do is, well, the opposite of what we just said. Eat anti-inflammatory foods.
Yeah.
Like fatty fish, green, healthy oils.
Yeah, the Mediterranean diet came up. That comes up a lot now. I feel like that's the hot new thing. But when I think of Mediterranean diet, I just think of don't eat like shit. So, eat better, exercise, no explanation there. It's good for you. There's a lot of science for that. We don't have to even talk about it. Exercise.
I think we talk about it all the time. You release a bunch of toxins.
It's just, it's exercise.
It's exercise. Better sleep.
Better sleep. So sleep is kind of like the foundation of health, right? That's what I feel like.
Yeah.
So, if you get better sleep, everything's going to be better.
Everything.
So do that. Managing stress, easier said than done on that one, right?
Well, we did just do 5 episodes on stress and fear and anxiety and boundaries. So if you're stressed out, you should go listen to all 5 of those episodes.
Right.
I think it was 25 through 30. No, 20 through 25. I think so. And then last but not least, quit smoking and drink less. So if you're going on benders every night, you might be a little fuzzy.
Yeah, you might be a little fuzzy. There might be some inflammation
brain
in the brain because alcohol is a poison.
Yeah.
And
it's the most widely accepted poison
for sure
in the world.
Yeah. So cheers to that. So, bro, inflammation outside of serious illnesses, right? Like arthritis.
Yeah.
And lupus, autoimmune diseases. If you have unhealthy habits, you might have chronic inflammation.
Yeah.
So, there's things to do, which is don't do all the unhealthy things all at once.
Yeah. Or take if you the older you get, like if you have 5 bad habits, take 1 out for like a year and then take another one out.
It's like me with the beach trip, I go on a bender.
Yeah.
We go to the beach with the boys.
Yeah.
And and my liver regrets it, but I don't do it all the time.
Yeah, it's not every week.
It's just once a year.
It's once a year.
Exactly. Yeah. Exercise, better sleep, managing stress, and quit smoking.
Yeah. And drink less.
Perfect.
Just said.
Well, I think that's it, bro.
That's how we reduce the brain inflammation so we can focus on our
dreams, bro. Let's do it. Let's do the plugs, too.
Oh, yeah. That was terrible.
Let's do the plugs, too, bro.
Okay, so go to formsandfocus.com, sign up for the newsletter, go to YouTube, subscribe.
Yep. Check out the TikTok.
Check out the
TikTok.
That's right, where we play, goof off, do those things.
Sweet, bro. Awesome.
Peace.
All right.